amplify the hepatotoxic, possible hepatotoxic effects? I don't know.
I have a general question to this problem of very severe infantile cases, and perhaps we can anticipate also to some problem related to genetics, because in those cases it seems that there is a deletion in almost all except one case. So is the unique type of correlation, genotype and phenotype. All we agree with this or not? But on the contrary, we have cases, adult cases, in which there is a deletion with adult onset, so classical onset with very slow evolution.
So, yeah, so not quite clear yet.
So this is a big problem from a genetic point of view, and from also a prospective evolution of the problem. Do you think that in those cases, very young with very severe cholestasis and hepatitis, so-called, there is a genetic only condition or several other factors that will influence the very severe clinical presentation? Because this is still a very open problem.
It's an interesting point. It's still and the patient described in the von Beer patient, there was the question about is it a CMV infection, cytomegalovirus infection. I think when we can start to investigate, for example, to start with the Dutch population of prolonged neonatal jaundice, we can identify mutation, and then perhaps we can answer your question, our question.
Do I remember well that one of your patients was actually a compound heterozygote for missense mutation?
Yes, the Amsterdam patient, the baby.
Yeah, the baby.
Was,
had so they didn't have a deletion, right?
Yeah.
And the same, our patient was a deletion.
Okay. Yeah,
and the same, the patient reported by
von Beer.
Yes.
Yeah.
Mm-hmm. And I'd like to maybe finalize before we go to coffee break with the general thought that I have, not just on CTX but in general, upon our medical practice. Dr. Bonnot emphasized that psychiatric patients are often not very well examined medically, organically, with a thorough medical organic examination, neurological examination, etc. That being true, I would add that the other way around is also true, and maybe psychiatry and neurology should have never been gone apart in Europe. At least in Spain, they are very totally separated disciplines, and that's a huge problem. I think that's a pity, because then there are other neurologists may agree or not with me, but I think we are not very good at examining or taking into account psychiatric manifestations when they are not severe. Let's say we are studying a peripheral neuropathy patient of unknown cause, and we may order the panel of CMT genes, but we may not pay attention that they had a depression 10 years ago, quite severe, or some other mild behavioral disturbance. Well, he's just a rare guy. And so the organic doctors, we are not good at paying attention that psychiatric manifestations may be a clue that peripheral neuropathy has a metabolic component. So that's another challenge that I leave here. How are you going to work together better and improve that? Anyway, so
Okay.
Unless you disagree,
No,
we can
actually,
close.
I agree with you, and I want to make an additional remark regarding the diarrhea. Patients get used to it, and adult patients, it's normal, but
They don't mention it.
They don't mention it, and neurologists don't ask,
Don't ask, exactly.
and therefore it's been missed.
Yeah, and of course we adult neurologists, we don't ask about neonatal events. I mean, it's just
Exactly.
forgotten.
Yeah.
Anyway, yeah, so thank you so much to all, and let's go have a little break and reconvene here in 15 minutes, 20 minutes, more or less. What time is it? What time is it now? Okay, so...